Hello, my name is Zahra Aziz, and I'm recording this lecture today from Monash University, located in Melbourne, Australia. This lecture is 4A in the GACD Implementation Science eHub Fundamental Program. But before I proceed with the lecture, I would like to acknowledge that this lecture and slides have been put together by our very amazing Izzy Benderek, who is the Research Capacity Manager of GACD. And I would like to extend my special thanks to her for all her hard work on this. So far in the fundamental program, we have covered implementation as a science. We have discussed the central importance of meaningfully engaging stakeholders and using theories, models, and frameworks. We are now moving on to module 4, which is all about assessing and understanding the context of your research study. So welcome to the module. As mentioned, my name is Zahra Aziz, and I'm a senior lecturer at the School of Public Health and Preventive Medicine at Monash University, located in Melbourne, Australia. I'm also a senior faculty for the GACD Implementation Science School, and it's my pleasure to record this lecture for you today. This lecture will cover 4 core questions in relation to context, followed by my favorite example. So firstly, why is content important? Secondly, what counts as context? We will then look at how can we assess and understand context. How can we incorporate contextual factors into the implementation process? And then we will look at how to use a banana to better understand context. And throughout this lecture, you will find prompts to reflect on the content. Feel free to pause the recording while you consider those questions. You are not expected to have any definitive answers to those prompts. Indeed, those prompts are intended to help deepen your understanding of the topic and your learning experience. The following 2 lectures after this one will provide you with some practical examples of real-life projects where 2 researchers will share how they have assessed and understood context for their studies. So you will get some practical implications, practical examples there. Now, let's start by considering these 2 images. On the left here is El Capitillo, a neighborhood in the Dominican Republic in Santo Domingo. It is considered one of the most dangerous neighborhoods in the country and is perhaps unsurprisingly one of the most deprived ones. On the right side of the screen is a stately home in rural England. It is a single house with large grounds just for one family. Now, I want you to think about all the interventions that we had during COVID-19 pandemic. We were introduced a range of interventions to minimize the spread of the virus, including quarantine, social distancing, wearing masks, only seeing certain family members in outdoor settings, shielding, contact tracing, and whatnot. What do you think would be the impact of COVID-19 interventions in these 2 settings? Would intervention fared in these 2 settings similar or different? Or do you think that same interventions would have the same health impact or different? Probably different. What this illustrates is the core importance of context in implementation success. From a research perspective, context is crucial. It influences intervention fidelity, acceptability, and sustainability, among other implementation outcomes. And ultimately, ignoring context can lead to implementation failure. I now invite you to briefly pause the lecture and take a moment to consider the context of the COVID-19 pandemic for your local area or region. What do you think influenced the success or not of interventions to prevent COVID-19 spread in your local area? Which factors do you think are unique to your local area And which do you think are relevant to other districts or countries? Now, when it comes to the definition of context, several groups have developed definitions of context for implementation research, and you can see quite a few of them here. You are not expected to know these all, but it just gives you a bit of different idea that people have related to context. Feel free to pause the recording and read through some of them at your own pace if you like. But having so many definitions can be a bit overwhelming. And the fact that there are multiple legitimate ways of conceptualizing context, it is no wonder people across the whole implementation science community get confused. One way to think about context in implementation research is not as a static picture, but as a living, breathing ecosystem. Imagine a forest, trees, animals, weather, all constantly interacting and influencing each other. Implementation research is not so different. We introduce intervention, but the setting, the healthcare facility, the community, national policies all play a role in how well those intervention works in that particular context. And this ecosystem is constantly changing. Think of new regulations, staff turnover, or evolving patients' needs. We need to understand these dynamics to adapt our interventions and ensure success. By embracing this dynamic perspective, we can ensure our interventions thrive within the ever-evolving context of implementation research. Now, having got a sense of what is meant by context, we can now start thinking about how to assess and understand it. In the previous module, we learned about theories, models, and frameworks. Once again, they are going to be very useful as we can use them to help structure our thinking about context. Now, look at this colorful structure. An inter-project working group at GACD has created a detailed framework to understand the complex environment influencing chronic disease interventions. It combines elements from previous research to enhance its applicability across different settings. The framework conceptualizes context across 5 different levels, which I'll show you in a minute. Try to think of these levels in the context of, say, chronic disease management. Firstly, individual and family level. For example, research shows us that the family's understanding and commitment to patient's care plan significantly influence the patient's ability to manage their chronic disease. So in that sense, understanding the family level factors become an important part of understanding the context. We then have community level. For example, we know that access to health education programs that raises awareness about chronic disease management can be quite useful in supporting patients and their care plans. Assessing the availability and quality of those services, those community resources, becomes part of understanding context. So again, it's a very important level to understand. Then we have healthcare setting level. So again, presence of chronic disease management diagnosis and support services in local health facilities, or whether healthcare professionals are trained in providing those services. These are all important part of understanding context. We then have a local or district level. For example, the availability of specialized chronic disease management programs can vary from one setting to another. Again, this information adds to understanding the context in which you are aiming your intervention for. And finally, we have national or state level context. At the national or state level, policy decisions and funding allocation significantly influences chronic disease management. So the level of government support for such initiatives affects the consistency and quality of these interventions across different regions. So again, very important to understand the contextual factor of relating to national or state level. And then this framework anticipates interactions within and between levels. In addition, it also includes a temporal component as an overarching theme applicable to any level of context. And there are many frameworks that can be used as a basis for organizing our understanding of context. For example, the Practical, Robust Implementation and Sustainability Model, also called PRISM, or the Consolidated Framework for Implementation Research, CIFR, or CIFR, yeah. Both conceptualize context in slightly different ways, and that is true across many implementation frameworks. The interpretation would be slightly different. A recent review found that most commonly addressed contextual dimensions were organizational support, financial resources, social relations, and support and leadership. And the least commonly addressed dimension was the physical environment. Overall, there is quite a lot of variation between frameworks in how they conceptualize context, and the combination of dimensions they address. So there's quite a lot of variability there. So now you might want to take a few moments to consider which theories, models, and frameworks you think would be helpful for assessing and understanding context in your work or area of study, and what might be the pros and cons of selecting one framework over another. Now let's discuss different methods for assessing context in non-communicable disease implementation research. There are qualitative methods, which some of you might have already used: interviews, focus group, to understand perceptions and experiences. We have quantitative methods, surveys, to gather data on resource availability and infrastructure. Or perhaps mixed methods approaches for a comprehensive picture. So combining both qualitative and quantitative methods. Now, this is another interesting example. A 2022 review aimed to categorize and understand different approaches to studying context, and found that few studies used established frameworks for analyzing context. So across the top here are different components of context assessment, including any frameworks used and research methods. Whereas we saw that mainly surveys and interviews were the most common ways to gather contextual data, and implementers were the most contextual. The interviews and survey were the most common ways to gather contextual data that was used quite often. And most studies looked at factors within the community or organization level. Interestingly, very few studies explicitly reported conducting context analysis using routine data or use observation qualitative methods. What this really shows us is currently there are many ways to study context in implementation research, and many ways to construct our understanding of context. Now, this might be a good time to pause the lecture again and reflect on which research methods or tools would you consider using to explore context at the individual and family level? And what about the district or national level? Would you use the same or different methods? Remember, there are no clear-cut right and wrong answers. And this is just an opportunity to start applying new knowledge to your own situation and work. So try to use this moment to pause the recording and think about those questions. We can also think about context from a complexity science perspective. Again, very important concept. Complexity science tells us that things in the real world, like healthcare, are constantly changing and influenced by many different variables. This means it is hard to predict exactly how things will work out, especially when dealing with complex systems with many moving parts. So when trying to make changes in these situations, we need to consider all these different influences and be prepared for some unexpected results. So context and complex interventions are difficult to separate and may not be helpful to separate them. You often can't separate them, and where methods that require a separation between context and intervention, such as randomized controlled trials, may not be able to capture complex and dynamic interactions between context and implementation. And if this is pretty interesting topic. If you're interested in this perspective, you can read more about this topic in the BMC article, special issue that was published in 2018, referenced here. Now, with this complexity in mind, implementing a new program or intervention can be like trying to fit a puzzle pieces into a constantly shifting image. And you might have heard of CICI framework that helps us understand this complexity. So imagine three overlapping circles: context, implementation, and settings. Context is the big picture, everything from culture to laws that surrounds your project. Implementation is how to do your strategies, your teams, your processes, your outcomes. Whereas the setting is where it all happens, shaped by both context and implementation. And crucially, there would be other projects that might be happening in the same place, affecting your work. So that becomes part of a context as well. Think of it as a crowded puzzle table where everyone's pieces interact. By understanding these interconnected elements, we can design more effective and sustainable interventions. Now, indeed, using the CICI framework as a theoretical basis, a team developed an approach to context assessment called Basel Approach for Contextual Analysis, or BANANA, for easy pronunciation, I guess. BANANA was developed in 10 discussion sessions with implementation science experts and a medical anthropologist. It entails 6 components: choose a map or blueprint, a theory or framework to navigate the complex world of context. Use real-world evidence to uncover the important details about your settings. Don't go it alone. Bring in the experts, those who live and breathe the context. Plan how you will dig deeper into the context. What are the relevant research questions on context, and how will you find the answers? Connect the dots. Figure out how the context pieces fit together and how they can shape your project. And lastly, disseminate and report your findings. Tell the world what you have discovered about the context and how it matters, because it's really important to report back the findings. Now, if you're interested to get further details on these stages, I recommend taking a look at this publication referenced here. So once you have collected and collated context data, what do you do with it? How can you use the contextual knowledge to solve the ever-changing puzzle? Well, your improved understanding of your study's context can be used to inform intervention design and your implementation strategies. This may include adapting components of the evidence-based intervention or program you are implementing to better meet local needs and preferences, addressing identified barriers relevant to your context, partnering with strategic stakeholders at different levels to promote ownership and sustainability, tailoring implementation strategies such as modifying materials, delivery methods, or communication strategies, and informing capacity strengthening efforts for healthcare providers. Now, I'll discuss addressing barriers slightly more in detail on the next slide. It is worth noting that not all implementation barriers can be tackled quite quickly. Changing company culture, for example, or workload issues, these things take long-term strategies and long time to act on. Identifying implementation challenges is helpful, but solutions involve knowing who, when, and how to address them. And people implementing changes need a complex skill set, including technical and relational skills, plus knowledge of implementation processes. So just understanding the barriers, there isn't enough. There needs to be a plan to address them effectively. And you will come to designing and testing implementation strategies in this next module of this program. So consider some of those factors and how you are going to address some of those challenges. Now, during this lecture, we have covered quite a lot of ground. We all have a good idea of what content is, but it is a slippery idea to work with. We went through why context is important, what factors and interactions might count as context, ways of assessing and understanding context, and how it can be incorporated into implementation. The next two lectures, as I previously mentioned, will give a practical perspective on context assessment in 2 GACD projects. But I'll leave you with these 5 key messages. Firstly, there are many ways to define the context of your study. Secondly, however you define it, context is crucial to implementation success. Frameworks can be helpful to structure or inform your approach to assessment and understanding of context. Mixed method approaches for context assessment help to develop a more comprehensive picture. And lastly, working with context allows researchers to adapt intervention components and implementation strategies to local needs. Here is a reference list if you wish to reference or read any articles further. Thank you.